A quick introduction. As Joe said, my name is Ed Vaughn. If anybody that's on the meeting can mute their iPads or cell phones, and then if they need to speak later on, they can unmute it. We're asking that all questions be held to the end. I think the presentation has been designed to kind of go through and answer everybody's questions, and then at the end of the presentation, we'll open it up and answer everybody's questions from there, and we'll go from there. Just a quick intro, though. As Joe said, my name is Ed Vaughn. I'm the senior partner here at the ENV Insurance Agency. I've got online with us today Kristen Wall from my office, and I've got Cindy Wise from Humana here as well. ENV is a 32-year-old benefit consulting firm that specializes in employee benefits, obviously. We have about 30 employees, and we currently work with over 130 school districts in New York State. So that's all I work on. That's all I focus on, and that's our specialty. Before we get into the presentation that Joe has on the board, I want to just address 3 questions up front that we kind of been getting asked quite a bit. The first question was, why are we doing this now? We're in the middle of a pandemic, and everybody's nervous, and we understand that. The district certainly is not taking this decision lightly, but unfortunately, I don't think anybody would disagree with anybody that it's a bad time, but the district still has to move on. The district still has to balance its budget, and even though the budget vote got moved to June, they still need to get their ducks in a row. In all schools, and Shenango Forks is not the only school that's in the middle of this, all schools are being forced to look at this budget. And we also found out that the new aid numbers coming in are low, and there could be quarterly adjustments. So it's going to be a very tough year for a lot of schools. There also are other schools that we're in the middle of doing this exact same thing with. I think I mentioned in my previous meetings, Canada-Harry is looking to make their move for 7-1. Maynard-Waddington is going to be 7-1. Harpersville made their move for 4-1. Owego went to 4-1. The soonest date that Shenango Forks could consider this option would be for a 7-1 effective date. So that's the first question we got asked quite a bit. The second question we got asked was, why are we using a consultant versus talking to the carriers direct? And the answer to that is really threefold here. Some of the carriers that we work with don't work with clients directly. They only work with consultants. So that's one answer. The other thing is that there's no discount for people that would use or go to the carriers directly. The rates are the same whether people use a consultant or not. The other answer, the other part 3 of this is, a carrier can only talk to you about their own product. So Excellus can only talk to you about Excellus, Aetna can only talk to you about Aetna, Humana can only talk to you about Aetna, where a consultant can talk to you about the good, bad, and the ugly about all the different carriers. So we've put together an analysis that we'll be going through within a few minutes that kind of breaks down how these benefit plans affect you and how they work compared to your current plan. We're here to be your advocate, and a carrier could not do that. The fourth reason, which I think is probably the most important, is that ENV has a call center. We're there to be your advocate. We have people there that are there from 8 to 5 o'clock, Monday through Friday, and we're there to answer your questions, and we're there to help you with any issues or anything that pops up. So that's probably the most important answer. The third question was, if it's too good to be true, then it usually is. How is it possible that these carriers can give us, as good or better benefits at a substantially lower price? And the answer is a few different reasons. The first thing is, people need to understand that currently right now, anybody over 65 years old, Medicare is paying 80% of your claims. However, the district is still being charged the same rate as the active people, where Excellus is paying all the claims. So that's a huge difference right there. The second part of that is, people under a Medicare plan would all have single coverage. So a husband and wife would have 2 singles. Under the current Excellus plan, a husband and wife are charged the full family rate. And it's never the same as 2 singles. It's a factor. And currently on the Excellus plan that's in place now, the factor is 2.5. So if your single rate was $1,000, the family rate would not be $2,000. It's actually $2,500. Okay, so you can see that factor's in place. The other reason is because Medicare is now paying these carriers like Humana and Aetna a large subsidy to provide better benefits than what Medicare provides and to provide better service. So between those three benefits there, that's why those carriers can be so much less expensive than Excelis. And you can see it was just one carrier. We've got three options on my analysis. Two options are close to $2 million in savings as a gross number for the district. The PowerPoint that Joe has on the board is just really a quick, a quick PowerPoint to discuss Medicare, and we'll go down through that to kind of make sure everybody's on the same page when it comes to understand and some of these terms that we'll talk about. And we're looking at, Medicare supplemental policies and Medicare Advantage plans. And you can see Medicare supplemental policies, they basically come in and they supplement Medicare after Medicare pays the claims. Medicare does not cover Part A and B deductibles and coinsurance, but the Medicare subs do. So you'll see in my analysis that a lot of time the retirees don't have deductibles to meet. They won't have coinsurances to meet. It's 100% coverages. Typically with a Medicare supplemental policy, it's a separate Medicare Part D prescription drug plan, and you have 3 ID cards. You have Medicare, a Medicare Sup ID card, and a prescription drug card. The new thing that happened in 2020, in January of 2020, on Medicare Sup policies is Plan F has changed. And all the Medicare policies are labeled A through, I believe, through J. And the Medicare Plan F plan is what we typically use because it covers 100% of all the different benefits. Well, effective January 1st, if you are 65 years old prior to January 1st, you could still be on a Plan F. If you were going to turn 65 after January 1st, you have to be on what's called now Plan G. And the only difference between the two plans is on Plan G, the Part B deductible is not covered. The Medicare Advantage plan provides Medicare benefits through a private insurance company directly. So it's everything's under one. Your Part A, your Part B, and your prescription drug coverage is all under the same umbrella. The out-of-pocket cost depends on the type of plan that are purchased. So these plans that we'll show you today have been customized to match your benefits that you have at Shenango Forks. These are not plans that you could purchase on the street and it's at the same rates. And we'll talk about that in a little bit as well. The nice thing with the Medicare Advantage plan is you do have just one ID card that covers everything. The last part of that that sheet right there says Medicare plans, the network is irrelevant. The network is irrelevant when we're talking in comparison to the current Excelis plan, because right now you've got a network with Excelis. When you go to any kind of a Medicare plan, you do not need to worry about a network. Okay, these are called passive plans, and as you can see in the next slide here, the passive network, as long as a provider accepts Medicare or does Medicare assignment, that provider is considered to be participating with a plan. 98% of the providers across the country will do will either be assigned to Medicare or Medicare assignment. Under the Excelis program that we currently have, they've got 98% of the people in the New York State area, but on a national level, it is only 80%. So there's more providers to choose from a national level than we do have right now. Also, retirees don't have to worry about doing any billing with the claims. All the claims are handled directly through the carriers or through Medicare. We get to the frequently asked questions, and obviously we have the first one there. What's the difference between Medicare Advantage and supplemental policies? We've gone through that. But I want to just point up here, the big thing here is that with Aetna and Humana, there's a star rating that these carriers have if you're a Medicare Advantage plan, and both carriers are rated 4.5 out of 5, so they have got very top level ratings. The next question is, will I have to switch doctors? And as I already said, no, as long as your provider accepts Medicare or does Medicare assignment, you'll not have to switch your doctor. 98% of the providers nationally will accept Medicare in some form. The only providers that I've seen it to be an issue with in my 32 years experience has been what we call private contracting physicians. And they are the physicians that say, Ed, give me $5,000 and you can have access to me 24/7. And if you were in that situation already, you would already know about it now because you would have signed a contract with that provider telling you that he's not taking any insurance, period. How are claims processed? to a Medicare supplemental policy, claims are processed through Medicare first, and then they go to the Medicare subcarrier, and then they're paid then. Under the Medicare Advantage policy, all the claims are submitted to the Medicare Advantage policy only. What tier are my prescriptions on? Most people at Shenango Forks currently have what we refer to as a 210 RX plan, which means they pay $2 for generic drugs and $10 for brand name drugs. That is going to be the same under these policies, okay? I want to talk about the tiers, though. Tiers can change, okay? So a generic, if it gets to be expensive, can become a brand, and a brand can become a generic. So what we've been told by these Medicare carriers is if the copay is going to go down, it can happen at any time. And if a copay is going to go up in cost, it can only happen January 1st. But tiers do change. Even on our current plan with Excelis, tiers change. Typically in the industry, we see tiers changing on a quarterly basis. Also, the carrier selected will have open formularies. What a formulary is the list of drugs that are acceptable to the plan. You currently have an open formulary under the Excelis Classic Blue. You have a closed formulary under the PPO, which means there are some exclusions there. The Humana and Aetna plans both have open formularies. Is there a donut hole? The answer is no. Okay, a donut hole only applies to individual policies that you buy on the street or buy off the TV ads or magazine ads. These group policies that we will be talking about today do not have donut holes, and a donut hole simply is a gap in prescription coverage when you get to a certain point. That's something you won't have to worry about here. Is there a pre-existing condition clause? The answer is no. No matter what you're being treated for now, whether it be a heart condition, a cancer condition, diabetes, whatever you're being treated for now will come over to the new plans if the district goes that way, and you will not have to worry about anything that's pre-existing. What happens if my spouse is over 65 as well? If your spouse is over 65 as well, because we're talking about, this only affects people post 65, your spouse would come with you. Now, if your spouse is under 65 and you're over, you would go over to the new plan. Your spouse would remain on the existing plan until they turn 65, and then they would go over. Do I need to be enrolled in Part A and Part B? And the answer is yes. Just like today, okay, you have to be enrolled in Part A and Part B for Medicare. What happens if I have any questions or any problems? ENV has a call center. We have 9 people that are here, 8 to 5, Monday through Friday. We're here to be your advocate. A lot of people have been speaking to us over the last couple of weeks. We've been going down through personal situations and verifying doctors and verifying prescriptions. And at the end of this presentation, anybody that wants to email me their name and their phone number, I can forward that information to Humana and Aetna. They'll verify whatever information you want us to verify, and they'll get back to you. And we've been able to do that in a pretty quick fashion. The last page on here is just a list of some of the districts that we have worked with in the southern area, the central New York area that have these programs. So I really had this list here to let people know, Shenango Forks, you're not the guinea pig. This is something that's happening. And with the new budget numbers, in the last week, we've received calls from 5 other districts that want to look at this as well. In full transparency, I'll just point out that Shenango Valley did not move all of the retirees. The teachers stayed, everybody else moved. And the other thing I want to talk about on here is Johnson City, which is not on here. Johnson City did move about 4 years ago to Humana, and they've been on that plan. That's a quick PowerPoint on Medicare, and Joe is going to be putting up the actual analysis that we'll go over. We did update the analysis. I'm still going to use the one that we have on the presentation today, but I do want people to know there were some updates made on the Humana side, and I'll point them out in my presentation. But we did send the district an updated presentation that has the new updates on it. I think there was a rate that was slightly adjusted, and it's there. We also have sent the district an FAQ, a detailed FAQ that basically took all the questions from all of my previous meetings, and we listed the questions and the answers. So if you didn't go to those meetings, you want to see what everybody else was asking about, you can see those. So those will be available to you as well.
And those are both on the website currently.
So as Joe said, they're both on the website, so anybody can grab those at any point. As we look at this analysis that Joe has on the board, you can see on the left-hand side, the way this is broken down is that the Excelis Classic Blue plan is the current plan in place now, which most people have. To the right of that is the Excelis PPO, and there's about 6 people in the district that have that plan. Then you can see to the right of that is the Medicare benefits for 2020, and you can see the Excelis Medicare sub policy, and then you see the shaded area. If you have a black and white copy, what I did here is put down is the benefit going to be the same as, equal to, or less than. So where you see a light gray area, it's going to be as good or better, and a dark gray area would show that it was a less than benefit. Then to the right of that is Humana with the same benefits, and then Aetna with the same scale after that as well. So as I go down through this, you'll start to see a pattern as we get halfway down through here and how this works. So the first thing is the deductible under the Excelis plan is $50 for an individual and $150 for family. Under the Excelis PPO, there are no deductibles, it's just copays. Under the Medicare benefits, you can see Medicare has a Part A and Part B deductible, but under the Excelis Medicare sub-plan, the deductible is covered, so no retiree will have to meet a deductible. So those benefits are going to be as good or better. Under Humana and Aetna, there are no deductibles there as well, so it's going to be as good or better. Standard copays. Under the Excelis Classic Blue plan, there is no standard copay because it's co-insurance. Under the PPO plan, it's a $10 copay for services rendered. Under the Excelis Medicare policy, there are no copays other than prescription copays. Everything's going to be paid 100%, as well as Humana and Aetna. You'll see 0 copays. Now, one question that got asked to me in the other meetings were, what's the difference between a 100% after Medicare and then a 0 copay? And the answer is nothing. They both mean the same. You're going to pay 0 out of your pocket at time of service. So wherever you see 100% after Medicare or you see 0 copay, that means you pay 0 at the time of service. The standard co-insurance under the Classic Blue plan is 20%, which means after your deductible, you pay 20% of the expenses until you reach an out-of-pocket maximum of $400 for individual and $1,200 for family. Under the PPO plan, there is no co-insurance, it's all copays. Under the Excelis Medicare plan, there are no co-insurance, doesn't really apply. And same thing with Humana and Aetna, the co-insurance doesn't apply because there is no co-insurance. Same thing with the out-of-pocket maximum. Lifetime max benefits under all these plans is going to be unlimited. So you don't have any limitation on any of these plans. The next category is physician office services. And the first thing is an office visit. An office visit currently is subject to deductible and co-insurance under the Excelis plan. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, it's covered 100% after Medicare pays their portion. And under Humana and Aetna, it's a 0 copay. So all 3 of those plans have as good or better coverage than what we have in place now. Chiropractic care, subject to deductible and co-insurance under the Classic Blue and a $10 copay under the PPO plan. Those plans cover spinal manipulation only.
You said there's only 6 people in the district that have that.
That's correct. Under the Excelis Medicare plan, they also cover spinal manipulation only, and then after that, nothing's covered. Under the Humana plan and Aetna, they cover spinal manipulation, which is standard, and then they also, both plans will cover routine chiro services with a 0 copay. That's an enhanced benefit from what we have today. The next category is preventative well care. So you can see your routine physicals, your adult immunizations, mammography screenings, pap smears, prostate cancer screenings, and bone density testing. That's all paid in full. And on the Medicare plans with Excelis, Humana, and Aetna, they're also going to be paid in full with either a 0 copay or 100% coverage after Medicare. So those are all going to be as good or better than what we have in place today. The next page gets into the first category is routine vision. So routine vision is currently not covered under either of our plans and not covered under the Excelis Medicare plan. Humana, it says not covered, but they have updated. It's one of the updates they made. So Humana is going to cover a routine vision exam with a 0 copay, 1 exam every 12 months, just like Aetna. So that's another enhanced benefit. The eyewear frames and lenses or contacts under the Excelis plans, they cover a set of glasses after you have cataract surgery under the Excelis plan and the PPO plan. Under the Excelis Medicare program, it's the same thing. And then under the Humana plan, it currently talks about a discount program. They have this other update they made. So they're also going to give you a zero copay for the covered services, and then they're also going to allow you a $100 allowance every 12 months to be used whatever you want for your eyewear. So basically, you can go out get yourself glasses or contacts, and then just send into the carriers for the $100 allowance. So both those carriers have the same benefit, and it's enhanced from what we have today. Hearing evaluations, currently with deductible and co-insurance under the Excellus plan. Under the PPO plan, it's a $10 copay. Under the Excellus Medicare program, it's covered 100% after Medicare pays their portion. And under Humana and Aetna, you'll see it's a zero copay, one annual exam every 12 months. Hearing aids. Hearing aids are currently not covered under the Excellus plans, nor are they covered under the Excellus Medicare plan. The Humana plan on the analysis here said it's not covered, but this is an update. They are going to give you the same benefit as Aetna. It's a $600 allowance every 36 months. So both Humana and Aetna have a hearing aid allowance that gives you that balance every 3 years. The next benefit section is inpatient services. So we talk about inpatient hospitalization stays, inpatient mental health, and inpatient substance abuse. They're all paid the same way. Currently, under the Excellus plans, they're covered in full 100%. And under the Excellus Medicare plan and Humana and Aetna, they are also all paid 100%, no difference. The inpatient physician visits are paid the same way, all paid 100% across the board to the Excellus Medicare plan, Humana, and Aetna. Next page, we get into skilled nursing. And skilled nursing currently under the Excellus plan is covered in full. Under the PPO plan, is covered in full up to 120 days. Under the Excellus Medicare plan, it's covered 100% up to 100 days, so that's a negative. Under the Humana plan, they currently initially had it listed for 100 days as well, which is also negative. They have since updated their services to read zero copay for unlimited days per benefit period. So under Humana and Aetna, it's going to match the in-force Classic Blue plan, which is going to be 100% covered in full. Somebody did ask us to do a little bit deeper dive in skilled nursing as to look at the, what do they use their guidelines for in determining the number of days somebody needs for skilled nursing, and we're in the middle of putting the finishing touches on that. And once that's done, we'll get that over to the district and we can put it on the website. The next category is emergency room and urgent care. Emergency room visits are covered in full under the Classic Blue plan, and under the PPO plan, there's a copay of $50. Under the Excellus Medicare plan, it's covered 100% after Medicare pays their portion, and under Humana and Aetna, it's a zero copay. And under Aetna, you can see it says includes worldwide coverage. We're going to talk about international coverage here towards the end of the presentation. Urgent care visits, subject to deductible and co-insurance under the Excellus plan. Under the PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare. And under the Aetna and Humana, it's a zero copay. So those are going to be as good or better than what we have in place currently. Outpatient benefits, we get into outpatient surgery. Outpatient surgery is paid in full under the Classic Blue plan. Under the PPO plan, it's a $10 copay. Under the Excellus plan, you can see it's 100% after Medicare pays their portion. And under Humana and Aetna, you can see it's a zero copay. So you can start to see already that between the Medicare plans and the Medicare Advantage plans, the pattern is it's 100% coverage after Medicare or zero copay. So the retirees don't have to worry about paying a deductible, any co-insurance, or any copays. It's all a zero copay so far. Outpatient surgery, covered deductible and co-insurance under the Excellus plan. Under the PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's a zero copay. So those are going to also be as good or better. Diagnostic lab and testing, paid in full under the Excellus plan. Under the PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it's 100% after Medicare. And under Humana and Aetna, it's a zero copay. So those have also matched our in-force benefits. The next page is radiation therapy and chemotherapy. Both are currently paid in full under our Classic Blue plan. Under the PPO plan would be a $10 copay. Under the Excelis Medicare plan, they would both also be covered in full 100% after Medicare pays their portion. And under Humana and Aetna, there's zero copays for both. So they're going to all be able to match or be better than what we have in place currently. Outpatient mental health. Currently under the Classic Blue, it's deductible and coinsurance. Under the PPO plan, it's a $10 copay. Under the Medicare plan from Excelis, it's 100% coverage after Medicare. Under the Humana and Aetna programs, there's zero copays. So again, as good or better coverage. Alcohol and substance abuse for outpatient. Paid in full, 60 visits per year under the Classic Blue, covered in full under the PPO plan. Under the Excelis plan, it's going to be covered in full after Medicare pays their portion, and under the Humana and Aetna plan, there's zero copays. Under the Humana and Aetna plan and Excelis, there are no day limit. So under the Classic Blue, as you can see, there's a 60 visit per calendar year. That does not exist under the Humana or Aetna programs. Other services, we get into therapies like physical therapy, speech, occupational therapy, pulmonary. Currently, that's deductible and coinsurance under the Classic Blue plan. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's going to be a zero copay. Diabetic supplies and equipment and education. Under the Classic Blue, it's deductible and coinsurance. And under the PPO, it's a $10 copay. You can see again under the Excelis Medicare plan, it's 100% coverage after Medicare and zero copays for both Aetna and Humana. You can see Aetna includes supplies to monitor blood glucose. That applies to both Humana and Excelis as well. They just happen to add that in their description. Durable medical equipment, currently subject to deductible and coinsurance under the Classic Blue. Under the PPO plan, it's a 20% coinsurance. Under the Excelis plan, it's 100% coverage after Medicare. And under Humana and Aetna, they're both zero copays. So as good or better. Prosthetics, subject to deductible and coinsurance, no calendar year maximum under the Classic Blue. It's a 20% coinsurance straight with a $15,000 calendar year max under the PPO plan. Under the Excelis Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, there's zero copays. So again, as good or better across the board. Home health care services, paid in full, 60 visits with 325 additional visits under the enhanced benefit. Under the PPO plan, it's covered in full, unlimited visits. Under the Excelis plan, it's going to be 100% coverage after Medicare. And under Humana and Aetna, they're going to be zero copays. So they're going to be also as good or better, no limitation to days, which kind of matches the PPO plan. Hospice care, paid in full up to 210 days under the Classic Blue plan. Under the PPO plan, is covered in full, no limitation to days. Under the Excelis plan, it's 100% coverage after Medicare. And under Humana and Aetna, there's zero copays. Those three programs also do not have any limitation to days, so they're going to be as good or better than what we have in place currently. Dialysis, currently paid in full under the Classic Blue plan. Under the PPO plan, also paid in full. Under the Excelis plan and under Humana and Aetna, they're also going to be paid in full with a zero copay or 100% coverage after Medicare. Acupuncture. Currently, acupuncture is not covered on our Excelis plans, and it would not be covered under the Excelis Medicare plan. It is covered, however, under Humana and Aetna with a zero copay, so that's another enhanced benefit that you would receive. We get to the last page. International coverage, currently I have listed as TBD. We do believe that Excelis is going to cover international coverage. Any emergency outside of the country is going to be covered like any other services. We don't see any issue with that. Under the Excelis Medicare program, emergency is covered within 60 days of the travel, subject to a $250 deductible with 20% coinsurance with a $50,000 lifetime max benefit. That is a negative. Okay, that's a difference. Under Humana and Aetna, both of those plans are going to be zero copays for emergency care outside of the country. So they're going to match what we have in place now with Excelis. Lifestyle benefits are wellness programs. Currently with Excelis, they don't have them. And under the Excelis Medicare plan, they don't have it on there as well. Under Humana and Aetna, we have the Silver Sneakers program. It's one of the most popular programs that I get asked about in these programs here. And Aetna calls it Resources for a Living, but it basically allows a retiree to be a member of as many gyms they want up and down the East Coast. It's a great program. They love it. Both Humana and Aetna have several discount programs that they make available to all the different retirees once they're on the program, and you'll see those. The next category is the prescription section. We talked briefly about earlier, and you can see under the classic blue, you have what's called a 210 copay. It's $2 for generic and $10 for brand names. You can see for a 3-month supply, you pay 1 copay, which is a discount. Now, there's no deductible and there's no annual out-of-pocket expense. Under the PPO plans of $5.15.30, $5 for generic, $15 for preferred name brand, and $30 for non-preferred name brand. There is no discount for a 3-month supply. There is no deductible, and you can see an annual out-of-pocket expense of $3,000 for an individual and $6,000 for family. You move to the right-hand side. Excellus was able to match our 210 drug card. They did not put the 51530 on there. I do believe that they would work with us, and if we chose them to put it on there, but they have not given that to us yet. And under the Humana and Aetna programs, they have matched our programs exactly. So it's a 210 program for the Humana on the for that side, the 51530. Under the Aetna program, it's a 210 and 51530 as well. And you can see also under the prescription program that Humana, Aetna, and our current Classic Blue are open formularies. One thing I want to point out to people on here, because it was a question, we're not trying to change your prescription drug coverage. If you currently have a 210 drug card, you'll still have a 210 drug card. The 51530 only applies to those people that are on the 51530 plan currently. Okay. Now, what I want to talk about here before we get into the rates is 2 things. Some people have mentioned that they believe that Excellus under the current plan has covered some of their deductible or their co-insurance. That's fine. That's called COB in our business, which is coordination of benefits. That doesn't change anything. It just still means that all the benefits to the right-hand side are going to be as good or better. So if that is true, that they have been doing some coordination of benefits, that's fine. It still keeps the benefit comparison the same. There's still plenty of enhanced benefits that we talked about between the chiropractic maintenance, the acupuncture, the routine eye exams, the eyewear program, and the hearing aid benefits. So and also the unlimited days on a lot of those benefits. So there's still plenty of added benefits that you don't currently have now. The other thing that I want to make sure I mention is the district has come to us and said, if there are any unforeseen benefits that would not be covered under the Medicare plan that were covered under the Excellus plans, we would be willing to self-insure them. Now, as I say that has to be negotiated, and we do not have the terms of how that's going to work, but it is something the district is willing to do and are willing to sit down and talk about and negotiate. So I don't have any details on how that is going to be, if you guys go down this road, how that'll look, but that is something that could take place. And then we get down to the bottom of the page, and you can see the way the rates broke down. And I think a lot of people were kind of surprised because people know what they pay for coverage, but they don't always know what the district pays for coverage. So when you look to the left-hand side, a single coverage cost the district $813.92 for a single and $2,035.97 for family. That is a monthly gross rate the district pays each month for each person on the plan. And for the PPO plan, it's $759.85 and $1,885.81 for family. Okay. When you move to the right-hand side of the page, the Excellus Medicare rate is $489.54, and for a family would be just twice that number. Under the Humana program, it's $305 for each individual, or $610 and change for family for the 210 plan. For the 51530 is $251 for a single plan. Under Aetna, it's $369.19 for the 210, and for the 51530, it's $337.78. Now, when you look at the bottom of my page, you can see Aetna could save the district $1.9 million, Humana is $2.1 million, Excellus is $1.5 million. Now, keep in mind that's a gross savings. So if the average employees spend 10% of the cost, 10% of that would go to the retirees for savings, and then 90% of it would go to the district. I think there was a question that was asked earlier also, what percentage of that number would actually go to the district? And it really is based on the percentage that the retirees pay. So, for example, I also ran those numbers, and I said, if a retiree pays 15%, which I think some people that I've talked to or that do pay that number, if they pay 15% of the current rates, they would spend $1,465 a year for single coverage and $3,663 for family. That same 15% under the Humana rates would be $549 for a single, for a savings of almost $1,500, and $1,098 for family, which is a savings of almost $2,500. That's a big difference. So the retirees save as well as the district on this. Another question that got brought up was, did the district, are they looking at this long term? Is this a short term fix or Band-Aid approach? How do we know that these rates aren't going to go skyrocket in a couple years from now, and then where we're going to be then? So what I've done is I've taken the Humana rates and I trended them forward 9%, which is pretty conservative, every single year. And it would take to the year 2031 to equal the current Excelis rates that we have today. And then I took it one step further and I said, okay, take the Humana rates and trend them up 9% each year. Let's then trend the Excelis rates up 5% each year, which is also conservative. And at the end of 2031, there was still a substantial difference in cost. So the answer to that question is, this is not a Band-Aid fix. This is a long-term solution. All of my districts that have moved their retirees to a Medicare program in some shape or fashion, to this day are still on those plans. Not one district has moved away from what they went, with that whole concept. So they're still there today and they're still saving money. So with that said, that's a lot of information in a very short period of time. And as I mentioned, as I started, the newest version of the analysis was given to the district. It is on the website, and also the frequently asked questions that Kristen Wall from my office put together is also on the website. So there's some more updated information for people there. So are there any questions that we can answer?
Yes, can you hear me?
Yep.
Yes, Pat, go ahead.
You said that there was a rating for 4.5 out of 5 for the two, I believe. Do you have any idea of what Excelis's rating is? And if not, where could I find it as a consumer?
Pat, the Medicare doesn't rate the Medicare supplemental policies, but you can go on to Excelis's website. They are rated, I believe, an A carrier. So they are also rated very well. But they don't rate the Medicare sub policies like they do the Medicare Advantage policies.
So do I understand you that Excelis is a supplementary and the other ones are Advantage?
That is correct, Pat.
Okay. And I walked out of the room and I think I heard you say something about a list of questions that people have asked that the district put together. Where are they located?
They're on the website, Pat. I think Joe put them up there maybe yesterday. The new analysis with all the updates and all the questions that were asked are on the website as well.
Okay, and I was talking to some retirees and some things that I came about with talking to them. Is it going to be put in writing that we don't need pre-approval? Does that go in writing?
Pre-approval for what, Pat?
Like if right now with what we have, we do not need pre-approval for like a CAT scan. Is that still going to be the same?
There will be some pre-approvals and some pre-authorization. When I looked at your contract, Pat, under the Excelis program, they don't say that you have to get a pre-approval. However, it does state that it has to be medically necessary. So it's got to be medically necessary. So somebody has to make a phone call. So under a PET scan or a CAT scan, the doctor would have to make that phone call to Humana, Excelis, or Aetna as well. Not something that the retiree has to do, but the doctor themselves would do that.
Okay, so I'm knowledgeable and I'm not going to speak to it right now, and I'm going to try to get a call into a retiree. And if there's anybody else on here that can help me, reach out to someone. I would like to know if I understood you correctly, because that's a big concern right there. And I don't know about the pre-approval with Excelis right now, because that question came from a retiree that we've heard that there's no pre-approval.
Well, the retiree themselves wouldn't be doing it, Pat. So, I'm not sitting here arguing with you because it's possible that they don't have the pre-approval on all their different tests. But the doctor, because of the language in the contract, somebody's got to make a phone call to Excellus to show that it's medically necessary to have that test done. So, and Cindy, you can add to this, Cindy, if you want, but I believe that's the same way it works with Humana and Aetna. The doctor makes the phone call and it's all handled, all behind the scenes.
Well, first of all, can I jump in, and excuse me if I interrupted? I want to make it very clear, this is discussion and not an argument, because
Right,
this
yep.
is important. So that kind of concerns me, that may make people not want to talk, and that's important. Right now, I know that if we go in under our insurance, which is for a working employee, they do not have to make a phone call to have it covered by our insurance. So I'm assuming that's the same with the Medicare Excellus. I may not. That's why I want to follow up and be accurate on my information. There is no doctor's office that needs to call. If you are right now, if we needed to go in and get a CAT scan, you can say to that office staff, you do not need to call because I know that it's covered. You don't need pre-approval. So I think there's some confusion there. So I will try to call out to a retiree about that. And the other thing is, I guess I spoke to someone, and I know this is time consuming and it takes time, but they were, first of all, coverage out of state, is it covered there? And they have called, or Humana has called 5 times. It's taken about 2 weeks, and they did not get back to me last night, and they said they would, but they still hadn't cleared up some information where they gave like prescriptions and infusions. So that's concerning. Like if we switch and we still don't have answers, like this retiree has gone back and forth now with 5 phone calls. So please know I'm very respectfully asking these questions because this is a very important topic. And but that pre-approval now really has me concerned, because I know that there are some insurances that you definitely cannot have a scan without pre-approval. So I don't know if it's different because it's Medicare, but
I think that sometimes I think that it gets into how they word it. I mean, the way Excellus words it in your contract is that the scan or test has to be medically necessary. So if a doctor's office did not make a phone call and then whatever reason it was deemed not medically necessary, it could be declined after the fact. And with the Medicare companies, whether it be Excellus, MedSup, or Aetna or Humana, they have doctors call up front, not the employee, the doctors. And Cindy, am I right? It's the doctor that calls in for the pre-approval and then they're good to go?
It is, but I will warn you that when you talk about the pre-approval, it's a doctor's responsibility. The member's not in the middle of it, but it is usually a 48 to 72 hour turnaround time. So if the doctor says, yes, you need a CAT scan or an MRI, it may not be that most of the time they can't schedule it at that moment anyways. They're going to schedule it at some point, but they still need to get that approval. So it could be 48 hours before they get that approval.
Right.
Well, I guess I just want to go back and say, I know personally and from other colleagues that I work with, they have actually, the office staff has said to them, you are correct. We did not need to call, or we did not need approval. So again, whether it's the different with a current employee opposed to Medicare, I respectfully disagree with that comment. And if I'm wrong, I will be the first to admit it, but you do not, at least from my advantage point of what I'm saying is, I recently heard a colleague who I actually think is on the thread right now, who shared that with me. So thank you. That's very concerning. Thank you.
I mean, I see your concern, Pat. I mean, it's a process. It's not it's a process of how something gets done, and I understand that. And that's something in all the districts that we're working with. I've never seen it to even be an issue. So I'll further clarify with Excellus how they eventually get to this deemed as got to be medically necessary language. And then, but I know with all the Medicare programs that we have in place, that they've got that pre-authorization to get that, to get that service done. So we'll further clarify that.
Okay,
The other
thank you.
question you had, Pat, was, regarding Humana getting back to people. We are trying to get back to people as fast as possible, but sometimes, we need more information or we need more notes, and we're trying to verify providers. And because you're not really a Humana or Aetna or Excellus client, it's a little bit more difficult to just simply just go out and just try to verify things like different prescriptions. And so we're going out there with Aetna and Humana, trying to verify as much as they can with people. And I believe, I know Cindy has spent a lot of time working with all these retirees to get them answers, and we are going as fast as we can. And I can't really speak to who hasn't gotten a phone call yet. Cindy, are you needing to call somebody, Cindy?
No, I think the people you're talking about, I just sent back their responses in full yesterday and this morning. So I'm holding back and not fully responding to everybody. I've been on the phone with them several times, but I'm trying to do it all at one time so I don't piecemeal it and give them information just about pharmacy and then follow up a week later or several days later on a doctor. And I'm waiting on some doctor's visits or doctor's offices to call me back, or trying to reach them as well.
Right.
Hello.
Okay.
And Pat,
Hello.
look at my screen. This is out there under the retiree
Hello.
employee health insurance. And then there's your town hall meetings and questions. If you click on it, it comes up right here.
Okay, sounds great.
So you know how to get out there, right, Pat?
Yep.
All right. So it's all out there for you.
Thank you.
Yep.
Hello.
There's a
Hello.
in the chat I want to read to you really quick. It says, does Classic Blue cover some things that Medicare does not cover or approve? Do any of the others some things Medicare doesn't?
I kept trying to find what does, like over the years under, like when I think I mentioned before, we had two districts that also self-insured. And I think one district had paid a little bit of money for some compression stockings, but I believe under the Medicare Advantage plan, Cindy, both Humana and Aetna are covering those, right?
Right.
So
I don't know about Aetna, but we are.
Yeah, I believe both Humana and Aetna are both covering compression stockings, Joe. That was the only crazy thing that I saw. Obviously, there are some coverages under the Medicare,
Hello.
like the acupuncture, some of the vision, some of the hearing that they don't currently have covered now. So there are some differences there. Also, routine chiro is an added benefit that they don't have currently now. So there definitely are benefits that would be covered under the Medicare plans that are not covered. And I try to make that list on there as detailed as possible. And I just don't see these coverage gaps.
Okay, I think.
Hello.
Question, Ed? Yeah, yes, go ahead, sir.
Hello. Oh, hi. Thanks. This is Alan Peters for Alan and Gail, and I might be one of the ones that Pat and Cindy were talking about for Gail Peters. And I want to thank Cindy for working up some of the information. We did receive some today, and I just wanted to get some more clarification because we did submit a couple of weeks ago some personal information just to test and see, how much this would cover and what we would have to follow up with, because Gail is very happy with the coverage in that we've used it a lot. We're very fortunate to have it along the way. So, our feeling is we wouldn't ever want to just change, but I know Ed has said that only $50 to $75 and few different calls has been rejected along the way. So we did check into a few bigger expenses we had and what we had. But one of the responses today, it had to do with checking in a hospital, and our hospital is one of the number one hospital in New York, Columbia Presbyterian.
Mm-hmm.
And, we're checking on this for everyone because with health insurance, you never know when you're going to need something. I mean, the analysis is great, and it's the part of the analysis that you don't anticipate that's our biggest concern. And we've had some of those where, we've used over $500,000 probably. But the response today on our hospital, the top hospital in New York, is that Columbia is not a contracted provider, but they accept our passive plan. So what is a passive plan?
The passive plans are what we're talking about with Humana. A passive plan means that a provider does not have to be part of a network to be acceptable. So typically in a PPO plan, you would have better benefits in network and not so good benefits out of network. Here, it wouldn't matter whether somebody was part of the network or not, they're still accepting the plan. So that's why you'll see, whether it be Humana or Aetna, that they'll say we're part of the passive plan, because they'll either do, they're probably doing Medicare assignment, so that hospital should be fine.
And Mr.
Okay,
Peters,
and
that's a really good point. I need to make sure that when I put things back in response and writing, that I explain what some of those terms are, not assume that you understand what I'm meaning. So,
well, just the important thing, whether it's nearby for anyone, is that it's covered. So the other
Right.
question I had, and we had a special need, which was approved through the year 2023 at $4,000 to $6,000 a month. And that's a cost of over $300,000. That was an experimental drug, and that's one of the things you run into when you have health issues that you never anticipate. That maybe there'll be an experimental procedure down the road. Now, we had to go to Excelis to get approval for that. It wasn't an automatic. We couldn't just go do it, and we did that. They approved it through the year 2023. At this point, Humana can't do that, and if we were to continue it, we would have to submit for another approval. But that is not an automatic thing if anyone else has anything like that.
and Humana does cover experimental treatments, but again, your physician would have to do the same thing with Humana as what they did with Excelis, and that is submit the diagnosis and all the codes and the purpose of the treatment so that we can give it a review as well.
Right. I just think it's important that if anyone else has anything like that, that they should, know that or check on that with you also, and that's going to take some time.
Other than the one person, Joe, that we knew contacted some retirees in other schools down there, has anybody called any of the other retirees in the neighboring districts that have gone down this road to just discuss how these plans have worked? We only heard from one person that actually did that, but that's, I mean, the proof's in the pudding. And I could sit here and talk about these plans, and so can Cindy and Kristen Wall, and we can do all the analysis and work. But like Mr. Peters is saying, really, until you're using these plans, right, you don't know, what, the process and how these plans work. Other retirees will tell you how these plans are working. And every district I've gone to, I've encouraged anybody to contact anybody, people I don't even know, just because I know in my office here, as our call center advocate, we do not get complaints. We certainly get a lot of questions, and sometimes there's a doctor that has a question or a concern about a code, but we're not getting complaints about things not being covered or these people had a hard time getting the service. That we just have not gotten that. And but again, I can sit here and say that until I'm blue in the face, it won't mean anything to anybody. I think that I would encourage people to speak to other retirees in those neighboring districts to find out how the plan works.
Yeah, I don't know that I've only talked to a few people, but that's a good suggestion. But at the same time, it's good to have the exact data and the facts. So I appreciate Dr. Peck saying. Let me just go through a couple more. I appreciate Dr. Peck saying we reimburse if there's anything that unforeseen benefits, as you say now. But originally, in the original discussion, it was going to be in the first, I think the last board meeting, that would be done. Now it's conditional on negotiations, which I guess I understand. But that would have to be something that would have to be long term. And I think Vicki Quatler said that it should last forever. And really it should, because the benefit you promise these teachers is written in the book. It's the Blue Cross benefit. That's what's promised. So, unanticipated things can come up, or something that's not that's not clear cut. And I guess just two more things quickly. As far as Excelis, because along the way with our different challenges, we've had to go through some appeal process, and right on Excelis's summary of things, where they did deny something. For us, not everything, I'd say 98% was approved, but we had to go through a few things. There's an appeals process and a grievance process. So what does Humana have if something is rejected?
That's a good point. There is an appeals process and the grievance process as well. Maybe that might be a good idea, Dr. Peck and Ed, if we take that and put it on your website as well, so that's published. I'll forget that.
One more question with the 18, what is it? It's 18-month rate guarantee. Is that just a rate guarantee, or are these benefits going to subject to change once this is, if this were to go through? What?
No, the rate
what would-
guarantee will hold the rates until January of 2022. So there's 18 months there, and the benefits are not going to change. The district is control of how the plan basically is designed. So, you know, the district is trying to provide a program that's going to be as good or better than what they have in place now. So, so that
I will say that if Medicare were to make some global changes and say from now on we're going to cover acupuncture, then that would be stated in there. But because they're negotiated benefits, the benefits will remain whatever your negotiations tell us as a carrier to administer.
Okay, those were my comments and concerns. Thank you again, Cindy, for your help.
Oh, thanks. And I was going to follow up with you guys today to see if you had any further questions. So I'll touch base with you.
Okay, have a good day. Thank you.
You too. Thanks.
Any other questions? Okay, then we will be back at 2 o'clock to do another town hall meeting. Thank you, everybody, for coming.
Thank you.
Thank you.